Voodoo Floss 101, using it along your forearm, elbow, and upper arm. So this is going to work a lot with creating a deep tissue massage through your arm, help to make things feel so much more relaxed. If you have any swelling in there, we're going to flush that out. If it's been chronic swelling, if you have really stiff and tight joints, this doesn't really go around the wrist so much. So please don't put this actually directly around the hand. That will kind of crush your skeleton out of position. It's very uncomfortable and doesn't actually accomplish much. We want to focus on massaging out the forearm, elbow, and your upper arm. So the way we're going to do this, usually the wrist and forearm is pretty simple and straightforward. Going around the elbow and up is a little bit awkward, but I'll show you the best way to do that. So when we're doing our hand, wrist, forearm, you keep it super gentle around the wrist and the forearm, but I do keep it around the wrist and hand. And that just helps to secure the wrapping a little bit more easily. So I create like this anchor strip. This will make sense when I compare it to going straight into the forearm or elbow or upper arm. And I do a gentle but snug wrapping around there. So it's not tight. You could wear that all day long. It's not going to be an issue, but it's tight enough that I can now pull on itself and it doesn't rotate around my hand. So it's stable. All right. So I need this to get started off. So I'm going to pull it tight. So it's pulled long, and I lay that with a half width overlap. So it's halfway over the previous loop. And then as I go around the bottom, I'm just gonna rotate it, spin it around my palm, and around the bottom of my forearm, it's quite loose. So I put it around, I'm not stretching it. And then as I come up the side, I stretch that and pull that around the top of the forearm. And then as I come around the other side, because it's grabbing onto itself, then I let it come back a little bit. So it stays stretched out over the top. It's a little bit looser across the bottom. So remember, your circulatory vessels, your major nerves go through the bottom of your forearm, not so much the top. And then just keep rotating it around. You see what I'm doing with my hand? I put it around in my fingers like that, so I can rotate it. Get better at it with time. This is something you have to actually practice. That's something people underestimate with Voodoo Floss. And so often see people be like, it's difficult, it's hard, I don't want to do it. You have to practice. This is legitimately a skill. It's something you have to do on yourself a lot to get good at and to get fast at. So of course you can relax your hand here, make the last loop. So when you get to the end of the floss, make the last loop a little bit, just bring that back a little bit so it goes a little bit slack. And now I can feed the end through. Easy. And that's gonna be really easy to undo as well at the end. So here, really simple, move your hand around, open and extend your fingers, go into a press up position and just move through that, or just simply walk around and move this around. Go around, just breathe deep, try to relax. Hold this for 2 minutes. So just moving around like this for 2 minutes. Once the 2 minutes is up, check this out. I can grab the end and I'm going to wrap it around my hand. As I go through, it's going to help to keep it together. And I can just very quickly and easily do that. Keep that hand moving around. And as I'm doing that, I just take the end there, let it unroll, and it's very easy to rewrap it from there. Easy. Now, keep that moving. I kind of tingly there a little bit. I did have it on quite tight. It's supposed to go on tight. It's supposed to be it's not supposed to be uncomfortable, but it will be uncomfortable. So now we're going to show, if I start at the elbow, this gets a little bit tight. If you are someone with a particularly large chest, it's going to be better to have someone else do this for you. Otherwise, it's just a very compact thing. So getting started off is the hardest bit. So if you're doing this yourself, I take the wrap, I'm going to lay it across my arm, so it's just led like that. I'm going to very easily get around, so I can just use my fingers to tuck that bit in. And this is kind of awkward. And you just do it until it wraps onto itself. That's why you got to be kind of meticulous with this. It is annoying, but once you have that anchor strip, we call it, it works out a lot better. But yeah, just get it in there. Good. And now you may want to do one spare anchor strip just to get it secure. But hey, I can pull that around. And now as I make that tight, this isn't moving now. And that's exactly what I want. So unlike the knees, this can go around the elbow just fine because you don't have an elbow cap. You have an independent kind of sesamoid bone floating around on top of the elbow. So you don't have to worry about crushing a bone into your arm. And then pull that. We're doing the same things with the forearm. Tight across the back, which is your triceps. Nice and easy around the bicep. So remember, your anatomy class, you have your brachial nerve and artery right there underneath your bicep. You don't want to be crushing that. It will drastically reduce the amount of time you can spend with this. But notice what I'm doing with my arms. I pull that around and I feed my arm through like this. This is why if you are extremely busty, this gets very awkward if you can't work with this space. If I pull that around, when I get to the other side, I pull that tight across the triceps and then loose across the inside. And then I can pull that around. And it's the same thing really as when I had it around my forearm. Move everything, move your hand around, still around the forearm a bit, move your elbow about, go do some press ups, just move around. You can also do like a Cuban rotation type movement. That does get something moving around in there, but just move 2 minutes. Make sure you set a timer, get that work in, then take it off, keep moving it for another 2 minutes before you stop. Easy. And take it off in the exact same way. Good. I can grab that end, let it go, and I can re-roll it. Easy. If you suffer with chronic pain, chronic injuries, athletic injuries, I have got you covered. My name is Ethan Hammond, and I am a strength and rehab specialist. I work with people who want to return to sport and fitness, but feel that they can't because of pain and injuries. I've helped people with conditions such as lower back pain, ACL tears, shin splints, neck pain and chronic headaches, and so many more things. Now, a lot of you will be going through things like this, like what I just listed above, and you're saying that you cannot train anymore. Bullshit. You have got to train, and you've got to train right. Train or complain, that is the way this works. Now, I work in person in Southampton, England, but I have online services as well if you're a bit further out. And I also offer free consultations to get you started with a free game plan and strategy for getting out of pain. All you have to do is to send me a text or a WhatsApp message to 07 305 231 339, and I will personally get back to you in the next 24 hours to get you started on the road to proper recovery. If you are serious about leveling up and making real change, this is how you start.